Welcome to Trinity's CancerCare Center. Accredited with commendation from the American College of Surgeons, Trinity's CancerCare Center is among the nation's best at providing exceptional care to patients. We've developed this virtual tour in order to help patients better understand the different elements that make our Cancer Care Center one of the region's most advanced clinics in the fight against cancer. From the minute patients and their families walk through our front door, Trinity's Cancer Care Center welcomes them into a warm atmosphere. Designed as a patient-friendly facility, Trinity's Cancer Care Center provides a modern clinic environment, complete with decor that separates itself from a traditional hospital setting. Patients entering the lobby will gain easy access to our front desk, making their check-in an easy one. Patients also have access to a resource room found just off the lobby area. Here, patients have a private area where they can gain information on their treatment options, check out laptops that they can use while at the Cancer Care Center, and conveniently take care of insurance forms with a social worker without the need of having to do so at home. Mirrors can also be found within this area, so patients have the option to try on caps or wigs in private as well. Patients checking in at the Cancer Care Center will also notice a privacy room built directly into our front desk. This privacy room was designed with patient discretion in mind and is a secure area where the Cancer Care Center staff can interact with patients to complete any administrative tasks privately.
We get to know them, we get to know their families, we get to know more about the patient than I think some people realize that we do around here. And so it's important to me that our patients leave here knowing that they're respected and knowing that they're going to get good care and knowing that when they come back, we're going to have a smile on our face to see them again.
Trinity's Cancer Care Center is equipped with a full support staff, which includes a team of experienced oncologists, a nurse practitioner, highly skilled nurses, social worker, medical assistants, and therapists, as well as an on-site pharmacy. A volunteer staff is also available for therapy services, including massages, wig fitting, and other classes. This allows patients to receive complete cancer services on-site without the need to travel to another facility. Many of the staff members at Trinity's Cancer Care Center have been helping patients here for a number of years. They are a familiar face to those seeking treatment and are dedicated to providing the best care for all of our patients during their visits here. Technology is one of the driving forces behind the success of Trinity's Cancer Care Center. Patients treated at Trinity's Cancer Care Center have access to state-of-the-art equipment and diagnostic tools that are at the forefront of cancer-fighting technology.
Having this center here in Minot allows for that patient to get the same type of quality of treatment with the same type of equipment that they would get in any of the major medical centers.
Devices such as the linear accelerator, equipped with onboard imaging capabilities, provide both stereotactic radiosurgery and stereotactic body radiation therapy. Trinity Cancer Care Center physicians also use computerized tomography simulation and three-dimensional therapy planning. These sophisticated imaging tools not only allow them to see in greater detail the area to be treated, but also the ability to plan and precisely deliver radiation to this area. High-dose rate, or HDR procedures, provide specific treatments to various locations in a short amount of time. These HDR treatments last anywhere from 30 minutes to 1 hour and are considered an outpatient procedure. Patients find this a convenient form of treatment compared to traditional hospital stays that can last entire weekends. Trinity's Cancer Care Center supports 18 separate infusion rooms for patients. These rooms are not only private, but also come equipped with heated massage chairs and flat-screen TVs, helping add to a patient's comfort as they receive treatment over an extended period of time. There are also 2 larger rooms designed for patients with special needs and allow more space for their convenience. The design of the infusion center also complements a centralized nurses station that allows constant care and supervision to patients at all times. Patients at Trinity's Cancer Care Center also have access to clinical trials that are linked to some of the country's most recognized cancer institutions. The tumor registry is also a powerful tool by which patient data at Trinity's Cancer Care Center can be linked to other organizations. This allows professionals across the country to collaborate on the best treatments and methods to help patients right here in their fight against cancer. World-class technology and a highly experienced staff, combined with an environment that provides warmth and comfort to patients.
I think that helping patients become educated on their disease is very empowering, but it also gives people hope. We're there for them, we're there to support them. I think that that's the most satisfying part of my job, is that I can actually help people and I can make a difference.
We are Trinity's Cancer Care Center, a center for excellence where patient care comes first.
Patient navigation is a process, really, where we put the patient first and we help them navigate through the system at Trinity CancerCare Center. We try to make sure that the patient understands the processes till they get to their treatment plan. Once the doctor is in a position where he can give them a treatment plan, we step in there and we give the patient the education they need to help them understand the treatment plan. We have a big responsibility as navigators to instruct them, to give them all the resources that they want, that we can get to them, to help them complete their treatment plan, to get through to the goals that they've set up with their doctor. We familiarize them with the staff at the Trinity Cancer Center, and we walk them through the different areas so they see where it is they're going to get treated, how long it's going to take, whether they can bring their family in with them. We try to answer all their questions so that they know what's coming at them. Navigation plays a big part in dealing with the rural patients because they may drive 2 hours to get here. And so when they drive 2 hours to get here, you want to make sure that they're getting all the tests they can in that time that they're here, so they don't have extra trips. We don't bring them back tomorrow and the next day when we could have done it today. And what's really good in it is the patients, because like I say, they're in a tough spot, yet they find a way to prioritize their life and make the most out of every day. And I don't think that most of us do that. It's a very hard thing to do, but they do it. And you know, they meet you on the street, they think you've saved them, and you know that they've saved themselves.